Well, hi, this is Ken Auerbach from Cartier, Bernstein, Auerbach, and Steinberg. If you or someone you care for has been injured from no fault of their own, please contact Cartier, Bernstein, Auerbach, and Steinberg at myinjuryli.com or call 631-654-4900. Whether auto or work-related, slip and fall, trip and fall, construction accidents, dog bite, medical malpractice, or nursing home neglect, or various other types of negligence, please contact me at Cartier, Bernstein, Auerbach, and Steinberg by visiting me at myinjuryli.com or call 631-654-4900. I will represent you with integrity and passion. Living in pain from no fault of your own can be emotionally and physically detrimental and affect all aspects of your life. Please contact me, Ken Auerbach, at Cartier, Bernstein, Auerbach, and Steinberg by visiting myinjuryli.com or call 631-654-4900 for an immediate and free consultation and the support and representation you deserve. Well, welcome everybody. If you're just joining us, this is personal injury attorney Ken Auerbach from Cartier, Bernstein, Auerbach, and Steinberg Attorneys, and welcome back to our program From No Fault of Your Own. As you know, it's our goal to give you an insider's view of bringing and proceeding with various types of personal injury actions caused by the negligence of some other party. And among these areas that we have explored and we're going to continue to do so are car accidents, trip and slip and falls, construction accidents, medical malpractice, dog bites, nursing home neglect, products liability, and really many, many other circumstances of negligence and the serious injuries that often occur. And through our journey together, hopefully we can remove some of the mystery and uncertainty, help you feel empowered, knowledgeable, and confident in the process. I'm here with my great co-host and my associate, Amanda Spinner. Welcome back, Amanda.
Thank you.
We told the listeners last week that you were away for a couple of days up in Martha's Vineyard.
I was. It was beautiful.
Yeah?
It was amazing. I would recommend anyone to go there. I'm
glad that you had a really nice time up there, and really glad to have you back here, Amanda, because it's hard to hold the fort here without you. And
I heard you did a pretty good job. Pretty solid.
Yeah, we had some guests on there. We had a couple of guests on the show. Okay, well, Mrs. Auerbach called in.
Very important, Mrs. Auerbach.
There's no question about it. She's the best. And we were celebrating our anniversary of dating, actually.
Okay.
42 years of dating.
Whew.
Telling you. She really should be up for sainthood or something.
You said it, not me.
Oh, well, it's the truth. Listen, the truth is the truth. Amanda, we are live today, so if they call in about a question about personal injury at our number at 631 here, 451-1039 in the studio, what can we give them, you think?
We will give you a From No Fault of Your Own t-shirt.
So we'd love to do that. We'd love to listen to your question. We'd love to help you. We'd love to really give you some answers to maybe some subjects you've thought about. That, maybe you have the possibility that you had been injured as a result of someone's negligence, but you really didn't quite know how to get through the system and what you could do. Or you may just have a general question. You might not have a pending situation, but you may have had something in the past or something that you're really just interested in relating to personal injury. Give us a call. We really love to talk to you about it. It really is very interesting for us sometimes to get questions, because what happens is you may think, oh, nobody thinks this is important. And sure enough, you'll ask a question, and the next thing we know, we're getting a call and somebody has an inquiry on a case. I can tell you that we were talking about it not that long ago, actually, with the great Dave Levinstein, who we've lost. And we were talking about just getting injured at home. Mm-hmm. And we were talking about working at somebody's house and you have a ladder up, and can you bring a claim or not? And, somebody called me up, and really the questions they had were very similar to what we dealt with on the program. And it wasn't as simple of yes or no, where in a text message or sometimes even on a chat, you could respond to it. We do chat, and we were able to do that. But I said to the person, really, I need to talk to you. So on Saturday morning, I gave her a call back, and we had a really, really lovely conversation about her husband's situation and whether or not he had a viable claim. And these situations are oftentimes life-changing. And they're life-changing because oftentimes it's not even something you'd even think is a possibility that could happen to you. And you're not you're hoping you're just going through regular life, hoping that you could continue to do that. You could continue to earn a living. And in her case, her husband actually he had been laid off from an employer, and he was doing some work sort of on his own, and he was getting calls, and he was up on a ladder. And while he was up on that ladder came down. And he really, really hurt himself. He hurt both of his legs seriously. And he's still out of work after several months. He'd been in ICU for about a month. And she really didn't understand what really the law said. And so we were able to take that time and explain it. And really, unfortunately, in her situation, there was no third party.
Okay.
And we say third party, somebody who we could bring a claim for negligence.
Right.
But I've had cases where there is a third party. You know, Amanda, we had one recently, right, where someone was up on a ladder. They were doing similar work, but the person who invited them over was supposed to be holding the ladder. And that person, of course, didn't intentionally, but negligently let go of the ladder to do something else for like 30 seconds. And unfortunately, that ladder slid out and that person was seriously hurt similarly. And that person did have a viable claim.
And I think you make a good point. You know, it's really important to call us and speak through the situation with us and let us know all of the facts, because like you said, every case is different. And sometimes there is a third party and it ends up being a case, but we wouldn't know that just from seeing a little text from someone saying what the situation was. So obviously it's really important to go through and have that full conversation with someone.
And then sometimes we'll get a call and somebody will call and say, oh, well, I was hurt. It's a workers' compensation case. So they know enough to know that they were injured on their job.
Right.
And the way it works in New York is if you're injured and you're working for someone, then you can make a claim for workman's compensation. And it arose out of and within the scope of your employment. And you can make a claim and you can get lost wages and you can also get medical expenses paid. But what you can't get is what, Amanda?
Well, you can't get pain and suffering damages from your employer. You can't directly sue your employer in New York State.
Right. And because of that, what happens is the recovery under workers' comp is going to be far less than if you can make a recovery for conscious pain and suffering.
Right.
So the person will call us up sometimes or just leave that message, and they'll say, well, they were just hurt on the job. And what we don't do in our office is we don't just tell our paralegals and receptionists and secretaries, well, if they call up and say if they were hurt on the job, just send them over to our workers' compensation attorneys. We don't just do that. And there's a really important reason for that. And that is, Amanda, what?
Well, like we said, you know, there's potential that there could be a third party and there could be an action. We have to hear all of the facts first. So we as the attorney need to speak with the potential client, figure out all the information and see what's really going on there.
And some of the cases where you really wouldn't even imagine there's a third party. You would not imagine that there was someone else other than your employee that you could sue. And we've talked about on the program about, as an example, ladder and scaffolding cases. And in cases involving height-related injuries on a ladder or a scaffold, there's something called the labor law in New York, which says that an employer, not an employer, a third party, an owner and general contractor are strictly liable if somebody falls from a height-related accident. And that means, just to sort of sum it up, is that one needs to go ahead and make sure that if you are an employer or you're that third party, you're that general contractor or an owner that's controlling a job or a commercial owner of a property, that the proper safety devices are available on the job. And that's something that oftentimes you just wouldn't know. And so we really need to hear you. We like to take the time. We'd like to inquire and make sure that if there's a way we can get you compensated fairly, that we're able to do that for you and you do it within the time constraints that are required in New York. In New York, for a incident involving a ladder case, it would typically be a 3-year statute of limitations, which means you'd have to commence an action within 3 years. When the statute of limitations begins is usually when the incident occurs, almost all the time. There are some exceptions to it, but you got to really just be thinking the shortest times. We always think about the shortest times, Amanda. We never take the chance that somebody will get extra time, because if you run out of time, it's too late. So if you think you have anything going on, or you think there might be something for a family or a friend, a relative, send them our way. We'll take the time. We'll talk about it. We'll vet it. And it's really worth it for us, and it's a privilege for us to try to give you the peace of mind, even if it turns out there isn't a matter that you could bring. At least you know that you tried. So you're on our program from no fault of your own, and it's really our privilege to continue to hopefully educate you, give you information that you're not just going to get easily on the internet or easily from somebody else. And please give us a call. We love talking to you. You call us all the time after the program's over. But don't be shy, right, Amanda?
Don't be shy.
We'll see you on the other side. We're going to have the great Dr. Fred Mendelson, great neurologist. He's been on here before. Well, welcome back to our program. If you're just joining us, this is personal injury attorney Ken Auerbach. You're on our program from No Fault of Your Own. We are live, and we are exploring the most important issues in personal injuries caused by accidents. You can call into the studio right now at 631-451-1039. As Amanda told you, if you do call in, you'll get one of our beautiful From No Fault of Your Own t-shirts. And if you or someone you care about has been injured as a direct result of someone else's negligence, give us a call at 631-654-4900, or you can get us on the web at myinjuryli.com. That's 631-654-4900, or get us on the web at myinjuryli.com. It would be our privilege to help you. And all of our consultations on personal injury cases are always free. It doesn't cost you a dime if you meet with us, and it won't cost you a dime if you retain us, because it's all on what we call a contingency. And we'll lay out expenses too. You won't have to pass those back either unless we are successful. And listen to our program, Amanda, when?
Every Monday from 4 to 5 p.m.
And so we are back, and we're going to get to the great Dr. Fred Mendelson. Before we do that, this show really is being dedicated to someone who's so special in our lives and in so many lives, touched so many lives, lived a really amazing life, really a person who nobody ever had a bad thing to say about, and she never had a bad thing to say about anybody. So this show is dedicated to Marie, and Marie's going to be greatly missed by so many, and we just want her family to know, and her friends to know, and the people that didn't know her, that she made this world a really better place. And we know where she is, and we'll be there someday, Marie. And we just are grateful for your life and what you brought to the world. So let's get back now to Dr. Fred Mendelson. And Dr. Fred, are you there?
I am here. Hi, Ken. Hi, Amanda.
Hi, Dr. Mendelson.
Well, we're so glad that you are with us today, Doc. We have you on the show. You are one of our favorite guests by far. And our listeners love listening to you. My clients love listening to you. My clients have had the opportunity over the years to have treated with you, and there is really a difference the way and the medical care that you gave over the years. I know that you are now retired. You still do some stuff part-time, and but Dr. Mendelson made a difference in the world. Dr. Mendelson practiced medicine the way you would want somebody to practice medicine, and when you went to Dr. Mendelson, he would treat you no different than he treats his own family, making sure that you could hopefully get better, letting you know what was going on, and giving peace of mind. Before we get to that and the details of Dr. Mendelson, some of the things we want to talk about today, yesterday was a special day. Yesterday was a special day, and the rumor on the street was that your wife, Sunny, had a big birthday.
Yes, she did.
And how many years was that?
She's 75 now.
I have absolutely no idea. I mean, I've seen your wife and I see you. I really do believe that you guys did something with the Fountain of Youth, because you guys look wonderful. You look great. And so we want to wish a very, very happy birthday to Sunny. and many, many more years, Sonny. And you're doing something right, Sonny, too, because you've been able to, you survived all those years when Doc would tell you that he was coming home shortly, and knowing the way he is, if he had patients there that had needs, shortly might mean anywhere between a half an hour and probably 8 hours, right, Doc?
It's very true. I thank you for your kind words, and Sonny will too when I see her.
Well, we're really good. And by the way, we know your granddaughter, actually, and you've told us about your granddaughter. I believe her name is Ella, right?
Yeah, that's correct.
Right, Ella Mendelson. Our wonderful Dana Tottori here, who one day will be on the big screen pretty soon. It's going to be happening, but she's an actress too. She was looking up Ella a second ago, and she said that Ella had, I think, 2.7 million followers on TikTok.
Yeah, actually, she was just filming a movie with. I can't really go into it, but yeah, she's in the middle of filming.
Wow!
Wow, I'm telling you. Well, I can tell you, Doc, you and your bride passed down wonderful genes. Okay. And, it's really a blessing, right? When we see our children and then our grandchildren doing great things. So, Ella, shout out to you there too. We wish you all the best. So let's get back to personal injury. And one of the things that I find very interesting, Doc, is as a neurologist, your job is, of course, to try to figure out neurologically what is going on with a person who comes to you that's having problems. And on our show previously, you talked about clinically examining someone, doing certain exams where you put your hands on them and you look at them, or you look at their eyes and different things like that. But part of it is also testing, right? And there's testing that can be done when you're assessing someone as to whether they have neurologic injuries, right?
Yes. Yeah.
And so let's talk about something known as electrophysiological testing, okay? Well, what is that? Okay, it's kind of a long word, or a couple of long words, and it could seem scary. But what are we really talking about? And tell us how it works, and how people can be examined and be evaluated to determine what kind of injuries they do have. Sure.
Well, the test is commonly called an EMG, which stands for electromyography. And there's two parts to that test. The first is the nerve conduction velocity examination, and that we use a very mild electric stimulus to stimulate a nerve, and then we record along different areas of the nerve fiber how quickly the nerve impulse gets from point A to point B, and what the amplitude of that response is going from point A to point B. So then we can tell whether or not that peripheral nerve is functioning normally, or is it being compressed or damaged in a way. The second part of the test, once we determine the nerve conduction velocities and amplitudes and whether or not they're normal or abnormal, we use a very, very fine sterile needle. It's like an acupuncture grade needle. People usually don't mind it much unless they're really terrified of needles, but it's really not very uncomfortable. And that needle is placed in various muscle groups that are stimulated by certain nerve fibers. So that way we can also tell whether or not the nerve that's supplying that muscle group is damaged or not. So that's a very important test to determine whether or not there's any damage to the peripheral nerves.
So when you say peripheral nerves, you're talking about nerves that are located where?
In the arms and legs, basically.
So, I think if we think about it for our listeners and we explain it the best way, right? A nerve fiber, isn't it really an electrical line in the body? It's connecting places, right? So it's coming from the spinal cord, and then it's going out into some part of the body, into the arms or legs or some other part, right?
Actually, they originate in the brain.
In the brain, down to the spine, correct?
Yes, through the spine and then out through various nerve pathways through the shoulder area or hip area, and then continue on into the limbs.
So this testing that you're talking about, Amanda, I found it helpful in the past when I'm in front of jurors is to explain to them that the nerve fiber is an electrical line. And if that electrical line is somehow damaged or somehow being impinged upon, pressed upon, then whatever either the organ or whatever the part of your body, upper extremity, which are the arms, or the legs, the lower extremities, there are problems, right? And we'll talk to Doc on the other side about, well, what kind of problems are they? And how do they manifest themselves? And how does somebody see that? And what could be done? So this is a really important area. When we get back on the other side, we're going to have Doc explain to us, and we'll have plenty of time in the next two segments as to how he identifies it and what is it saying to someone. And for him is, how does he differentiate between what injury it might be and how do they get it fixed? So we will see you on the other side. Docs, thank you so much for coming on here. And we thank you again for Sonny and her 75 years.
Thank you.
Well, hi, if you're just joining us, this is personal injury attorney Amanda Spinner from Cartier, Bernstein, Auerbach, and Steinberg, and you're on our program from No Fault of Your Own, and we are live where we are exploring the most important issues in personal injury caused by accidents. You can call into the studio right now at 631-451-1039. If you or someone you care about has been injured as a direct result of someone else's negligence, please contact us at www.myinjuryli.com or call 631-654-4900. We would be privileged to fight to get you justice. That's myinjuryli.com or call 631-654-4900 or find us on Google under Ken Auerbach, Auerbach, for a free consultation. Please listen to our program every Monday from 4 to 5 p.m. as we explore these issues.
Well, really, it's great to be back here. We have the great Dr. Fred Mendelson, and our show, of course, is dedicated to wonderful, wonderful person, Marie. And you're greatly missed, Marie, and you really made a difference in our world. So we're so excited to be able to dedicate this show to you. And also, we have Dr. Mendelson on the show, and we're talking about some of those issues, Amanda, that do come up in our cases.
Yes.
And let's get back to the great Dr. Fred. Dr. Fred, when we were on the other side, we talked about these electrophysiological tests, the EMG, nerve conduction test. So tell us how you use them to diagnose, let's say, certain different injuries. Let's start with, let's go with the arms, into the hands and into the legs. How are they used, and how do they differentiate between different types of injuries, and why were they important to you?
Sure. Well, I guess the one test that everybody's most familiar with is the test for median nerve injury at the wrist, also known as carpal tunnel syndrome. So carpal tunnel syndrome means that the median nerve, which is probably the most significant nerve that goes to the hand, runs through the carpal tunnel. And
that's in the wrist, right?
In the wrist, yes. And the part of the wrist where flexion occurs as you bend your wrist down. So if that is damaged, or if there's a tight ligament pushing on it that cuts off some of the nerve supply, that's called carpal tunnel syndrome. And the most important test to diagnose that is the nerve conduction test. So if the nerve conduction is normal, traveling from the shoulder through the elbow, and then it's normal traveling from the elbow to the wrist, but slows down across the wrist, then we know that there's a problem in that nerve at the carpal tunnel. Now, depending on how severe it is, it might require surgical intervention or not. And that's something else we can determine from this test. Because depending on how badly the nerve conduction is affected through the carpal tunnel would give us some insight as to the best course of therapy, whether or not surgery is indicated or not.
And Dr. Mendelsohn, how long does it take to conduct this test? So if a patient came and wanted to undergo this test, or you wanted them to undergo it, how long would that take?
Okay, so the answer to that, Amanda, is if you want to do a slapdash nerve conduction test, just looking at that one nerve, that could take less than 10 minutes in the hands of a good therapist. However, the problem is if you just do that, you're not really testing all the other nerves in the limbs. So let's say, for example, if the patient that we're testing has a diabetic neuropathy or any other form of peripheral neuropathy that affects all the nerves, if you just test the median nerve at the wrist and it's abnormal, well, yeah, it could be carpal tunnel syndrome, but it also could just be part and parcel of a more diffuse neuropathy.
Right.
So then if you send that patient to a hand surgeon, then the hand surgeon's going to call you up and say, what are you sending this guy to me? I had him in the operating room. I opened up his carpal tunnel and there's nothing wrong with it. Well, there's nothing wrong with it because we didn't do enough tests. We didn't look at the other nerves in the hands and legs to determine whether or not that abnormality that we picked up is part of a more widespread neuropathy, or was it in fact carpal tunnel?
So that's
to answer your question,
yeah,
it takes a little longer to do all four limbs. It would probably take approximately 35 to 45 minutes to do a full, thorough nerve conduction survey of the hands and legs to know exactly what we're dealing with.
And do you do it based upon the patient's presenting symptoms, or you would just test all four limbs?
Well, you certainly have to do it based on the patient's symptoms, but I think if you don't test all four limbs, you run the risk of missing
right.
Too many other problems. Yeah.
You know, so one of the things that is always concerning to me from a legal standpoint and representing a client is when a client comes to us and their symptoms are either not being asked about or they're not conversing with the doctor and communicating with the doctor. And sometimes that could be a language barrier even, where they may be Spanish speaking or speaking in some other foreign language. And they go there and there's nobody to interpret for them. And the doctor now doesn't have the information. The patient hasn't given the information, or sometimes it's not just a language thing. It's just knowing that it's so important to communicate it. They're thinking that they're walking in there and the doctor's going to be able to tell automatically, right? And so I think it's really important that there be that communication between doctor and patient, where the patient discloses all the information. I know sometimes, most of them have a questionnaire and they'll answer questions, but that the doctor takes the time and makes sure that the possibilities are explored. Do you agree with that?
Absolutely. That's absolutely true.
And so, like, from my standpoint and Amanda's standpoint, what we do in our office is we don't just ask a client, well, what is in pain? Where are you feeling pain? Because you may have an area where you're having symptoms that's creating the problem, but it may not actually be painful. It may be tight maybe, or it may maybe have some discomfort, but not terrible where you'd think to answer that question. And so I think that the lawyer has an obligation too, when the client comes to them, and go through from top to bottom and ask those questions. Amanda, right? We do that.
Yeah, I think it also comes with experience that you notice you'll ask a client, oh, what did you hurt? And they just go to the immediate worst possible thing that they hurt. So if they had a fracture, oh, well, I fractured my foot. So And then you'll start saying, well, did you hurt anything else? No. And then you'll go through the head, you'll go through the shoulders, you go through the neck, you go piece by piece, and they go, oh, well, yeah, that is bothering me. So they don't always know to say like lesser, maybe things that are bothering them less. And I think sometimes they're not even aware of it because they're in such acute pain for certain things. So I do think it's really important to go from head to toe with everyone.
So Doc, I know you are very thorough. Okay. And when my clients would see you, you do a thorough exam, you would take the time, and you would make sure that if there was something there, you weren't missing it because there was a lack of communication, weren't missing it because the right testing wasn't done. But I think it's important from the attorney standpoint, if you're handling personal injury, that you take enough time. If you're going to consider taking this case, you take enough time to go through it, because first and foremost, you want the person to get better. If you want them to get better, then they need to report it. They need to report it to their doctor. And if they're not reporting it, if somebody has a nerve injury, Doc, you can't automatically, as an example, if there's a nerve injury in their hand, right? You can't just look at them automatically and say, oh, there must have been an accident and they have a nerve injury in their hand, right?
No, absolutely.
You know,
some patients are more verbal than others. But some people just come in and they say it hurts. And you have to really do a lot of testing and a lot of questioning to find out why it hurts and where it hurts.
All right, so we're going to come back on the other side. We're going to follow up on that. And you're on our program from No Fault of Your Own. Thanks for listening. We're really glad to have them here today, Amanda, huh?
Very glad.
Well, welcome back to our program. If you're just joining us, this is personal injury attorney Ken Auerbach here with my great co-host Amanda Spinner, and we're so glad to be on the radio here with you and having our program from No Fault of Your Own, where we are exploring some of the most important issues in personal injuries caused by accidents. If you or someone you care about has been injured as a direct result of someone else's negligence, contact us. Give us a call. We'd love to speak to you. And it's at myinjuryli.com. I'll call 631-654-4900. Dana in the studio, of course, is laughing at us because Dana does that accent all the time. I love it. I love your English accent, Dana. So I do. She's great. I just got to try to get the brogue for the jury. I love the brogue. The brogue is great. And you can always get us here live on the radio on Mondays and during the week at 631-654-4900 or get us at myinjuryli.com. All of our consultations on personal injury cases are always free. If you retain us, it's all on a contingency. Will not cost you anything unless we are successful. And we do have a caller on here. We're going to bring Ron on in, and we're going to get back to the great Dr. Fred Mendelson. Ron, welcome to the program. Really glad to have you back with us, Ron. What do you got for us today?
Yeah, I'm going to follow up a little bit, Ken. I live here in Mastic, and they're putting in sewers. They're putting in sewers everywhere eventually, 8 pumping stations. You know, the roads are so bad, okay? They're real bad. We've seen an accident. A person went into this indentation from where they had dug up the ground, and the ball joint broke. I pulled over. She had a broken ball joint, and an airbag went off.
Wow.
Yeah.
You know, Ron, that's really... Ron,
I gave her your name and number.
Well, hey, thank you.
Her neck was bothered, but she doesn't know.
Well...
What if something falls off of, a vehicle or...
Yeah, Ronnie, that's a great point, though, right? Amanda, we've done shows where we've had some of our great local government officials. We had legislator Nick Caracappa on here.
Yes.
And he was all over the fact when...
His mother's was great.
Yeah, his mother was great. And he was all over the issue with regard to the expressway, if you recall, Ronnie, and the parkways, where there were these incredible holes on it. People were having damaged their vehicles and then getting hurt.
And he was actually a witness to an accident on the LIE, which is what prompted him to start action and get, the roads fixed up.
And Ron, it's really a good point. If you do see something out there, okay, if there's a hole someplace.
The guys, I seen a weed whacker fall off of a trailer. The driver has no idea. And that thing bounced and it could have potentially went through a window and killed somebody.
Yeah, you don't know that. But on the roadway stuff, though, it's a really good point. And as the roads are being worked on now, technically, we wouldn't have to show actual notice of that defect if they created the condition. In other words, they created the defect by opening that up. But what I would say to everybody is this, Ron, it's really important, okay? And we've told our listeners this is if you see it, so if you see it in the town, you need to put the town clerk on written notice of that defect. If you see it in the county, you need to put the county legislative clerk on notice of the defect. Literally written notice. And it may take you an extra couple of minutes of your day, but the fact is that someone could get seriously hurt. And if they're not on written notice of it, it's a problem. Well, they could call me, but before someone gets hurt, they should identify it and report it in writing, because if it's a defect that they're not aware of, and the county or the town's not aware of, and there's no written notice to the right places, then their defense is on a roadway or on a sidewalk that we were not on written notice, and therefore there's no responsibility. So Ron really brings up a really, really good point. We've encouraged you to do that in the past, folks. If you've had a situation like that where you have been injured as a result of some defect in someone's property, whether it's public or private property, we do those cases. Please give us a call. We'll go through it. We'll try to examine it, see if the appropriate notice is there, and we'll try to get you justice.
Witnesses, people.
Witnesses.
If they see that go into a person's windshield, I mean, they should get a plate number, get something.
100.
Help them.
Ronnie, 100%. Listen, we got to go back to Dr. Mendelson, but
thank you very much for answering that question.
But as always, Ron, we really appreciate your calling, and really, really raising important points. So we're going to get back to the great Dr. Fred Mendelson.
Yeah.
Okay.
I had a nerve conduction velocity test.
You did?
It was painless. My right foot. They did all the way down the leg. They moved it, and they found that I had a dead big toe. My big toe I put a cigarette out on.
All right, so just listen to it. We're going to get to Dr. Mendelson, and we'll talk about that. All right, thanks a lot.
Okay.
All right.
Bye-bye.
Are you there, Dr. Mendelson?
Yeah, he's right. The roads are impossible.
Yeah, the roads are impossible. And he just said that he had nerve conduction tests on his leg, and it identified literally there was no feeling in his big toe. And so I would assume if there is injury as a result of something, and there's nerve injury, and there's no feeling in someone's big toe, that would be something that you'd be able to identify through the testing that you were talking about. Am I correct?
Yes, and it's actually the only way to determine whether or not someone actually has a nerve injury that's causing symptoms in the periphery like that. The only
And these injuries, right, we've talked about it on prior shows, but these injuries can be caused by trauma, right?
Yes, definitely.
And
one of the most common, sure.
Okay, and so a person's in a car accident, okay, and let's talk about, we talked about carpal tunnel syndrome. A person's in a car accident, they can have one of these injuries or these injuries to the actual median nerve, because they're holding on to the steering wheel, right? And now there's an impact, and that nerve gets entrapped because of that actual contact and the force of the other vehicle striking into their vehicle, and the force gets absorbed into the wrist, right?
Exactly. I've seen that hundreds of times. Yes.
Well, it's interesting. You've seen it hundreds of times, and the medicine says that it happens, and it's interesting. You could believe, Dr. Mendelson, that the insurance companies always want to explain it as something else. They want to explain it as, this can't happen from a trauma. And then I'm fighting with them. And then only if the person did the right thing and went to someone like you, got examined by you, had the right testing, made sure they reported it right, am I able to then get them compensated what could be a very serious injury?
That's true. And they're lucky if they go to you. Let me tell you, they're really very, very good at this. You and Amanda.
Well, Doc, we do appreciate that. And, I really think that there should be this relationship in terms of the attorney and also doctors, the treating doctors from this standpoint. None of the doctors that have ever treated any of my clients will ever say anything but what actually they see or know. And I know that's the way you are. And we would expect or want nothing different. But I think there has to be this communication where, and sometimes it doesn't really directly have to be with the doctor and the client and the attorney talking, but it's the client in the middle of it, right? They're the main subject of what we're both trying to make sure that that person gets the treatment they need to feel better, but also so that we can prove something. And so I think it's important that we realize that we need to communicate as lawyers. And I know you feel, right, Doc, that the doctor has to communicate. And, sometimes I even had in the past where you've said to the person, make sure that you let Mr. Auerbach know that these are my findings and this is what I'm finding. And I'm willing to stand by that and I'm willing to support it. And that's really critical. So we really appreciate it. We have to have you back on soon because we didn't get nearly enough time with you today. It's never enough time with Dr.
Never enough.
Okay?
I would like to.
Happy birthday, Sonny.
Yes.
Happy birthday, Sonny. Many, many more.
Thanks for coming on, Dr. Mendelson.
All right. We'll see you all next week.
See you next week.
Okay.
Bye.